After weeks of being talked up and fawned over by public health officials, the new COVID-19 vaccine from Johnson & Johnson is finally starting to make an appearance in California. In most quarters, this has been a cause for celebration. Doses that don't have to be stored in freezers and can be administered in one shot instead of the two required for the Pfizer and Moderna vaccines? No wonder I've heard several politicians call it a game changer, especially after so many months of supply shortages. But in other quarters, the arrival of the Johnson & Johnson vaccine has been treated more as a cause for concern, yet another reminder that having doses available and actually getting them into people's arms in an equitable way are two very different challenges to overcome. At issue are fears about the effectiveness of the newest vaccine compared with offerings from Pfizer and Moderna, and suspicions that it will be sent primarily into poor Black and Latino neighborhoods where cases of COVID-19 have been the deadliest. Both state and federal officials have insisted that they're taking steps to ensure the latter doesn't happen. That they are going to put Johnson & Johnson in our communities really feels like a slap in the face, said Corey Matthews, Chief Operating Officer of Community Coalition. It just doesn't feel like it is the best shot. It feels like a second-class shot. Meanwhile, the messaging from public health officials has been consistent: take whatever vaccine is offered. All three will save your life and prevent you from ending up in the hospital on a ventilator. The brand doesn't matter and neither do the efficacy ratings. The vaccines are all safe and basically the same. Matthews, who has been going door to door, booking appointments for people in South LA who otherwise probably wouldn't know how to get vaccinated, is skeptical that such messaging will work on a population marginalized by systemic racism and distrustful of government institutions. Persuading people to set aside their hesitancy and get immunized has required educating them about the Moderna and Pfizer vaccines, Matthews said, and adding a new one to the mix could undermine progress. People don't know what Johnson & Johnson is, he said, and so won't get it. Then there's confusion over efficacy ratings. The Johnson & Johnson vaccine had a lower rating than the other two vaccines at preventing symptomatic COVID-19 infections. But it's also not that simple. All three vaccines were tested in different clinical trials in different conditions and never head-to-head, so a direct comparison of the sort everyone wants to make is actually impossible. You're already talking about hard-to-access, hard-to-reach communities, Matthews said. And now we're going to basically undercut the little bit of progress that we've made. Detroit Mayor Mike Duggan was even more blunt when he initially turned down doses of the new vaccine for his constituents.